Hi, Mr. and Mrs. Lake. It's a pleasure to see you again. I wanted to spend a few minutes today to talk about a concern you had about your long-term care and kind of explain a little bit more about Medicare. First, what I'd like to talk about is Medicare. In fact, Medicare is secondary to any employer-sponsored healthcare benefit. It's broken up into 4 different parts. Part A is the part that you pay out of your payroll taxes, so there is no premium to participate in Part A Medicare. With this part, you have a $1,260 deductible for the first 60 days of hospital care. After that, from 60 days until 90 days, you have to pay $315 per day for your hospital care. You also have a lifetime reserve of 60 additional days if you should need them. If you use any of this time, you do have to pay $630 per day for its use. Part A also covers skilled nursing care, home health services, and hospice care. And in order to qualify for the skilled nursing care, a medical professional has to certify that you need the care. And you have to have been in a hospital for 3 days with a condition that needed this care. With the Medicare Part A, you will not have to pay for the first 20 days of care. It's fully covered. From days 21 to 100, you have to pay $157.50 per day, and Medicare will pay the rest. For days 101 and beyond, you'd have to pay the full coverage of the care. The next part of Medicare is Part B. This is voluntary. You have to sign up to it. It's a supplement to Part A. You have to pay a monthly premium that's based on your current modified adjusted gross income. For your current Magi, you'd have to pay $209.80 per month for this care. What Part B includes is clinical research, ambulance services, durable medical equipment, mental health, preventative services, second opinions prior to surgery, limited outpatient prescription drugs, physician services, home health care services not requiring a hospital stay, diagnostic tests, drugs that cannot be self-administered, cost of medical equipment needed, and all outpatient services of a hospital. Then we'll talk about Part D. This is also a supplemental insurance to Part A. This one covers your prescription drugs. It is based on your Magi, your current Magi. Given your current Magi, you must pay your premium plus $31.80 per month for this use. After you've satisfied your deductible under Part D, you only have to pay co-payments until you have paid and the plan has paid a total of $2,960 for covered drugs. After that limits, the patient has to pay 100% of all prescription drug costs until the patient has paid $4,700 total. At that time, then you can return back to the co-payments until the benefit period is expired. The last part of Medicare is Part C. This one's a little bit different, and it's actually referred to as a medical advantage plan. It's a healthcare option that is provided by a private insurance company, but it is approved under contract with Medicare. This part is equivalent to having Part A, Part B, and most of Part D. They have individual premiums based on the private insurance company, and all those premiums can be found by calling 1-800-MEDICARE. There are a few other options you can consider when thinking about your long-term care costs. One of them being a viatical settlement. What a viatical settlement is a company will purchase an existing life insurance policy if you should become terminally ill. Once they purchase the life insurance policy, they'll pay you 50 to 80% of the face value of the policy. They then, as a company, will make themselves beneficiary, and once you pass, will take the proceeds of the life insurance policy. Another option for you is an accelerated benefits rider. This is also an option with life insurance. You can pay a little extra with the life insurance policy to have the benefits of being able to accelerate your death benefits. So this would be money that you would be eligible to receive at death, but with this rider, you'd be able to receive it a little sooner. Yet another option is long-term care insurance. Long-term care insurance, the benefits generally include all of those, most of those not covered in your health insurance, Medicare, or Medicaid. These plans tend to be a little bit more expensive with their premiums for what they offer. The benefits are, however, excluded from taxable income, which is also subject to a $330 daily limitation. In order to qualify for this tax advantage, the policy must be guaranteed renewable. It cannot pay for expenses that are reimbursed under Medicare. It cannot require hospitalization prior to paying nursing home benefits. It cannot exclude any specific illness, such as Alzheimer's. It must offer inflation protection. Long-term care insurance covers skilled and immediate nursing care, custodial care, home health care, assisted living, adult daycare, and hospice care. In order to start receiving the benefits through long-term care insurance, you need to be able to perform 2 out of 6 of your daily living activities of daily living for at least 90 days without the help of someone. And activities of daily living include the ability to eat, bathe, dress, transfer from your bed to the chair, using the toilet, or maintaining continence. There's an elimination period associated with long-term care insurance before the benefits will start. The last option you can consider is self-funding. This simply is saving money for the use of your long-term care needs. You can save this money in some investment that you're already comfortable with, whether it's a savings account, a certificate of deposit, investments, etc. For your needs, I feel as though you should look into Medicare, especially Part C, if the premiums are favorable. What Medicare doesn't cover, I suggest that you do a self-funding approach. Given your net worth, I feel as though you could set aside some funds and be able to utilize this option.